And so one of the things that I think about a lot then is whether you're Sam's Club or another enterprise, what are some of the things that would give you comparative advantage? Well, one thing is size. Can you go into the marketplace like Walmart, like Sam's Club, and say, because of our size, we're going to help influence terms and conditions of a transaction? Well, if you think about it, the United States is 300 million people total. 300 million people total. There are more people under the age of 18 in China than we have in our entire country. There are going to be more people transitioning from rural China to their view of middle-class Chinese lifestyles in the next 30 years than we have in our entire country times 2. That does not account for India or other places around the world. Do you think we're going to win on volume, at least in terms of our demographic? Probably not our comparative advantage, at least in terms of the number of people that we have. Well, what about price? Are we going to be the world's low-cost provider of services? Are we going to underbid Cambodia? Are we going to underbid Vietnam? Are we going to underbid Mexico? And are we going to underbid various other places around the world? I have to tell you quickly, I met with a CEO not long ago. He said, Tim, the costs on the East Coast are killing me. He said, the labor is getting out of control, the regulations are tough, the bureaucracy is burdensome. I said, wow, this is my opening. I think, come on to Minnesota then, get off the East Coast, come on to the heartland. He said, I'm talking about the East Coast of China. I got to move inland to avoid those East Coast charges on the coast of China. So do you really think we're going to be the low-cost provider? And even do we want to be? And the answer to that is no. And to get there, we would have to so degrade the quality of life of our country and our people, it would not be worth it. That being said, we also can't price ourselves out of the market. So this is all a long way of saying, if we're not going to be the biggest, and we're not going to be the cheapest, then we better be the smartest. And smart on the broad sense. Smart in terms of our country's strategic direction, smart in terms of anticipating the future and planning for it, smart in terms of our specific public policies. In the time that I have left, I want to give you 3 concrete examples. And under the banner of value, and I'm so delighted that we have Doug speaking right before me, when you go to Sam's Club, what are people looking for in large part? Value, right? They don't have more money to spend. When I go to Sam's Club, I don't have more money to spend, but I want to get the best value for my money. That's missing in government in dramatic measurement. And 3 quick examples. First of all, in terms of being the smartest and value shopping and representing our citizens' interests in that regard, we have got to reform the education system in this country. If you want to see a horrifying article, go pick up Time magazine from 2 years ago and see the cover article, The Dropout Nation. The United States of America in the year 2007 or 2006, the dropout nation, a third of our people dropping out of high school. If you drop out of high school, there's a 60% chance you end up in the criminal justice system. There's an equal or higher chance that you end up on one or more of all the government programs, government housing, government transportation, government health care, and on down the list. It is not good for them. It is not good for us. You cannot do what my great-grandparents did or my grandparents did or my mom and dad did. If you miss the educational rung today or the skill rung today, you are in big trouble in this economy. You can't just go make a living anymore very well missing the educational or skill rung. We cannot compete as a nation of just 300 million people leaving our third of our team on the bench. And that's what we're doing. It is intergenerational. It is now spanning the decades. It is a moral and economic and social crisis. And I hate to use that word because everything's a crisis nowadays, but it is a crisis. One of the best things we could do as legislators and policymakers is dive into this and fix it. Now, not much has changed in this system in 30 or 40 years, but here's a couple of quick thoughts, and I won't go through them all. But first of all, besides parents, the number one influence on how a child's going to do in school is their teachers. We do not have the level of quality, rigor, subject matter mastery, preparation, and effectiveness in the teaching core that we need, particularly in areas of concentrated disadvantage. The school districts themselves should be charting and designing a different future. Unfortunately, they're not, but outside groups are. And one example is Teach for America. They said, look, and amongst others, we're going to go get the best and brightest people from Harvard, from Stanford, from the University of Michigan, all over the country. And we're going to say, we don't care whether you stay 30 years, but at least for a while, will you come and teach? Will you take that PhD, will you take that master's degree, will you take that turbocharged brain and come and dedicate it to a cause or purpose, which is the education of our children? And their results are astounding. We need to have a recruitment and retention effort around higher quality talent for our teachers. They need to be better trained. We need to support them as they come into the field. And importantly, we cannot pay them in a 1940s industrial model where the money's all aligned to seniority. Do you know what the correlation is between the seniority of the staff and the educational results of the children? About 0. So as we talk about education reform, we have to make sure we clearly define what the mission is. And the mission is our students learning. What are they learning? How fast are they learning? And the money needs to be aligned to that. We also can't say, we got a chronic shortage of teachers in the areas like math and science. And by the way, we're going to pay them the same as the gym teacher and the social studies teacher, and we got 10 times too many of them. In the real world, if you've got a shortage of something, you pay more for that. And so I think it's okay to say we're going to pay more for those high-need, high-impact areas that we got a shortage in. In addition, we can't get the best talent to go to the most challenged sites. What's wrong with paying more for getting them to come? And we have to tie the performance. And lastly, we need alternative pathways into teaching on the other end of careers as well. If you're 55 years old or 60 years old, and you're willing to spend the last 3 or 5 years of your career as a scientist at 3M, going into the schools and teaching junior high chemistry, God bless you. And we shouldn't have to spend 4 years out at the University of Minnesota to do that. There's a way to get an accelerated pathway back into teaching as a public service. And there's more on that front, but I want to shift to healthcare real quickly. Our healthcare system is busted. It's putting undue pressure on cities and school districts and counties and states and businesses and families and individuals. If we don't fix it, it's going to break the back of our country. In some ways it already is. Most people cannot follow this debate or don't want to follow it very deeply because your eyes glaze over if you get into healthcare policy reform. If you're uninsured, people just want to know, can you get me some insurance? If you are insured, people want to know, can you make it cheaper? Can you make it more affordable? And the answer to that has to be yes and yes, but how we do that is very important. In my view, here's the fundamental problem with our healthcare delivery system in the country. If I say to you today, after this lunch, go buy a television set without regard to price, without regard to size, without regard to quality, and I will pay for it, you go buy it, pick any one you want, how many of you would show up back at your hotel room tonight with the 12-inch black and white? Answer, nobody. You cannot have a system where people get to go to a provider and consume goods and services, being mostly ignorant of the cost, being mostly unable to discern the quality of the product and service, and then have a third party, namely the government, an HMO or an insurance company, manage and pay for the relationship. In what other walk of life does that work? It defies what we know about markets, it defies what we know about human behavior, and the system is flat busted. The incentives are all wrong.